Welcome to KRQE's New Mexico News Insiders. Here's Gabrielle Burkhart and Chris McKee. Sponsored by New Mexico PBS.
So we've had some pretty cold temperatures in this new year, including this week where we're recording this. It's been well below freezing for several days in a row here in Albuquerque and across much of the state. And we know that cold weather can have deadly consequences, even for those who are healthy, but even especially those who are living on the street as well are really subjected to the issues with cold weather. And the effect that comes with extreme temperatures, we should note as well, it only increases the risk for those who are recovering from medical issues. And those could be medical issues from the small ones, like you've got a cut on your leg, to the big ones, like continuous health problems that people may deal with.
For sure. And we know that there are shelters available, but for a lot of different reasons, that isn't always the place where people want to go or can go, especially when they have, like you said, medical needs. But there is a place that's been in the works for that very purpose. Today, we're taking a deep dive with some of the people behind Albuquerque's Medical Respite Collaborative. As of this recording, it's still on the horizon for 2025, but let's introduce our guests. This is Rachel Biggs, the Chief Strategy Officer for the program, and Kate Morton, Chief Clinical Officer. Thank you both for being here.
Thanks for having us.
So let's just start off with introducing you all. Rachel, let's start with you. Can you tell us about your role in the program and who are the key players involved in getting the ball rolling?
Sure. I'm really excited to talk about the Albuquerque Medical Respite Collaborative. We've been working on this for about 8 years. And so my role as Chief Strategy Officer 8 years ago, I was not in this role. I was doing development and fundraising for the organization. But we came together with our leadership and looking at strategic planning, saw a really great opportunity and a big gap in the community. So with the support of the National Healthcare for the Homeless Council, that there are programs across the country that are doing medical respite. They have been for decades. So we got to learn from some really great leaders and some of our partners. We took that and some of the technical assistance here to Albuquerque and working with our partners. So the City of Albuquerque, UNM Hospital, the Heading Home, Barrett Foundation. We came together as a work group to start thinking about what this could be and looking at what the resources that we already had in the community. There were some beds that were set aside for respite at the shelters at Heading Home's Albuquerque Opportunity Center, at Barrett Foundation, but we wanted to think about how we could build on that system and have something with a little bit more of integrated healthcare services on site and a real focus on exit to housing.
Okay. And Kate, tell us a little bit about your background. Where were you before this project?
Sure. So I'm a little bit newer to the organization. I've been with Albuquerque Healthcare for the Homeless for a little over a year now. It's definitely been a dream job for me. So I'm the Chief Clinical Officer. I'm a pharmacist by training, and basically I oversee all things clinical and medical. We have psychiatry department that I oversee, as well as the pharmacy and our dental department. And so I'll be working to help lead some of the medical focus around medical respite, this medical respite collaborative with our partners. So very exciting. This is something that the providers and all the staff at Healthcare for the Homeless have been waiting for a long time, and we're all really excited to see it open.
Yeah. And so just to be clear, Healthcare for the Homeless has been around for a long time. It's a agency that's been here in Albuquerque doing work exactly to the name, providing healthcare services for the homeless. But this new medical respite part is really a newer component that the City of Albuquerque, I think, is partnering on as well. And so let's talk a little bit about that. We have talked about the Medical Respite Center on this podcast before, I think in a couple interviews with Mayor Tim Keller and some of the folks who've worked with what's now called Health, Housing, and Homelessness, the department with the city. But what is this Medical Respite Center we're talking about? What does it offer? Who will it serve? Where is it?
So this Medical Respite Collaborative is located in the newer Gibson Gateway Center, so very close to the VA. It's the old Lovelace Medical Hospital, and it's a 50-bed, basically a home-like environment is what we're really considering it as, and what we've built it to look like for folks. The medical respite is really there to help people who are too sick to be on the street, but not sick enough to need a hospital. And so rather than keeping folks in the hospital for longer than they need to be or longer than they're medically they medically should be, this is an opportunity for folks to be able to recover from serious illness, surgery, sickness, chronic illnesses, so that they're not living on the street, but that they have a great place to recover. So if you think about it, if you were to go into the hospital and have a major surgery, when you were done with your hospital stay, you'd be released back home and you'd be given discharge instructions that may include, maybe elevating your leg and staying in bed for, a few weeks. You might have your friends and family bring you food or take care of you, remind you when to take your medications, some of those pieces. And so for folks experiencing homelessness, many of them don't have those resources and that opportunity. And so that's what respite has been designed to really help focus on.
And I know we see that on the street sometimes. There are folks who you presume are unhoused, who are sometimes in their medical gowns still, on the street. And so sometimes I think it is a very visible issue, but even still, there's probably people who aren't in medical gowns who are dealing with these recovering continued issues like, raising your leg. If you're released from the hospital, can I imagine be far more challenging to do on the street than it is at home if you have one.
And so this place, it has a 50-bed capacity inside the Gateway Center on Gibson. To be clear, this is not a place, though, where people can just drop in, right? Police and fire can't just take somebody on the fly. If I understand correctly, it also cannot serve people with like acute mental health needs. These are people that we sometimes might come across on the streets who don't really seem to understand what's going on. So can you tell us about some of the inclusion criteria for the facility and who it will serve?
Yeah, good question. So I think the important thing to remember is that this is a place for folks who can do their own activities of daily living, such as feeding themselves, getting to the restroom, dressing themselves. They should be able to do those things with minimal help from someone else. This is not meant to replace nursing homes or skilled nursing facilities for people who need more intensive assistance and recuperation. Those places exist and are great for those types of folks needing recovery. This is for folks who normally would be perfectly fine to recover at home. They just don't have a home. So some of the inclusion criteria would be folks who, if they're in a wheelchair or they have mobility issues, that they're able to navigate those pretty much themselves. Folks should be able to feed themselves, and we do have oxygen available in medical respite, so it's okay for folks to be discharged who use oxygen. We have that as a available service for folks, but for the most part, they should be able to really navigate their own recovery with minimal intervention.
And how does the referral process work? Who can make referrals?
Yeah, so right now, out of the gate, our partners can refer. So from UNM Hospital, from Albuquerque Healthcare for the Homeless, and also from First Nations. And we have a referral form that folks would fill out. And then we have a nurse at Medical Respite who will be reviewing all of those referral forms and making sure that the folks who are being referred in really meet those criteria. The idea behind that is, obviously, we want to make this available to the folks who need it the most, where it's not about restricting access or anything like that, but we want to make sure that we really have this process dialed in. We have a whole evaluation plan that we're doing for the first number of years that Medical Respite will be in operation, and we want to make sure that we get it right and that we work out any of the kinks before we open it up to a more broader list of folks to be able to refer in.
I know we talked a little bit about this. For example, it's things like keeping your leg elevated, maybe if you get discharged with some sort of injury. But can you give us some examples of what sort of medical issues or needs that a person would have in order to stay at this medical respite center, and how long can they stay?
Yeah, absolutely. So we know from our national partners that people typically will stay in medical respite for anywhere from 45 to 60 days on average. That's an average. Some people only need maybe a week or two. Some people take a little bit longer to recover, and we really want to individualize that as much as possible. So when people arrive at medical respite, one of the first things that our nurse will do is work with the medical team and really come up with a good, solid care plan for that patient so that we can individualize it a bit. I think, one example I'll give is we had a patient a few months ago who presented to our outpatient clinic, and they had very, very severe wounds on their feet. And so this person was working at a car wash and had a really hard time in his workday keeping his foot dry and making sure that wound was healing. And so we saw him over the course of weeks to do wound care and make sure that we could really help that wound close up. So this is somebody that didn't need to be in the hospital, right? But really couldn't do their day job, and they had a really hard time having this chronic infection close up. And so we were able to put them in a medical motel, which is something that we've had access to for quite a while now, and that's one way that we offer medical respite right now. And we were able to see this patient for many weeks, and they came back and had these nurse visits, and the nurse really helped heal their wound. And now they're back at work. They've since been able to see us for a lot of other conditions that they now feel more comfortable seeing us for, and participating in other of our programs and offerings at Healthcare for the Homeless. But this would have been somebody who would have been a great candidate for medical respite. So they needed some short-term help to really literally get back on their feet, and help that wound close up.
Yeah. You mentioned off camera when we were chatting, Rachel, that this was a design space based on community needs, focused on post-hospitalization and pre-hospital usage, for example. So I'm wondering, is part of the thought process also to reduce the burden in our healthcare system to handle cases like this, where maybe somebody, would show up at an ER or a hospital like, my foot is killing me, does that also reduce that workload?
Exactly. And that's why UNM Hospital is such a key partner in this. And so we approached it as a really collaborative model with the hospital to think about, you have a challenge, right? You have people experiencing homelessness that might be staying on average 4 days longer than someone that is housed in the hospital. We know that hospital census can be challenging, especially right now when it's so cold and there's a lot of people in the ER, a lot of people in inpatient hospitalization that are looking for a place to be safely discharged to. And when there's not a lot of options, people stay in the hospital longer. And so having medical respite, these new 50 beds, will definitely decrease some of the burden on the hospital. In our needs assessment that we did 8 years ago when we started this collaborative, we identified a need of at least 100 beds. So this is a model that we hope will expand in the future as well. And that's why it's the Albuquerque Medical Respite Collaborative. And this partnership model that we have created and worked so hard on, I think can grow and be replicated. And so the Gateway Center is the first 50 beds, and then in the future, there'll be hopefully an expansion of that too. We know that we will fill those beds very quickly. We know the need is there. So we're looking forward to being able to show that need and then demonstrate the effectiveness of the model with that independent evaluation that we were able to design ahead of starting the program.
We'll be right back with more of the New Mexico News Insiders.
Hi, I'm Logan Rader, host of New Mexico Living. New Mexico News Insiders is sponsored by New Mexico PBS.
If you like New Mexico News Insiders, learn more about New Mexico in Focus, a weekly hour-long show analyzing decisions impacting New Mexico statewide. Stream it anytime, anywhere. Visit nmpbs.org and follow them on all social media platforms.
Now back to New Mexico News Insiders.
You mentioned UNM was a big partner in this, and sounds like continues to be. But what are the other partners involved in this? I understand, the Gibson Health Hub has a ton of different services and agencies already incorporated in there before this center has opened up. So, simply put, how many other sort of providers are around in the Gateway Center there, and where does the funding come from for all of this?
Good question. So at Gibson, there are a lot of other service providers there. The City of Albuquerque is certainly a really important partner in this collaborative. They are providing the space for medical respite, and they're funding the operations of the space. Healthcare for the Homeless, we are the lead medical respite provider team there, but we're also working with First Nations, our other federally qualified health center, and they have a Healthcare for the Homeless program as well. And so they'll be a very important partner there. So patients will have a choice of their primary care provider, if it's Healthcare for the Homeless or First Nations. But we will take the lead on the medical respite services. But certainly the City of Albuquerque has been an important partner to ensure that we have a beautiful space to deliver services in. And then they're paying the contract for the shelter operation partner, which is Heading Home. And Heading Home, we've been working with them since the beginning as well through different leadership. Connie Chavez, their executive director, was actually at Barrett Foundation when we started this process, and we included Barrett Foundation in our initial work group as well. So we've had some longevity in leadership too throughout these many years to get us to where we are. But the city will be paying for that shelter operations, so the food and linens, the kind of room and board services there. And then Albuquerque Healthcare for the Homeless, we are leveraging our federal funding, our federal grant to deliver our integrated healthcare model. So all of the services that we provide at Albuquerque Healthcare for the Homeless and that we provide on integrated health outreach throughout Bernalillo County will be available at Respite as well. So our full suite of services are available to our clients. And that includes all of the services that you heard Kate speak of that she oversees, but also our extensive social services, Art Street, our community art program, harm reduction, will all be available to clients there. We also will leverage Medicaid billing. We will bill for services, and then we've had great partnership with the state Medicaid office. They've been a phenomenal partner working with us and supporting a waiver in the Medicaid program that's been approved by the federal government, by the Centers for Medicare and Medicaid, that allows us to pilot medical respite as a covered benefit in the state. And that's pretty groundbreaking. And in the country, there's not many states that have done this. We've followed suit with a few others. We are one of the first to do that in the country. And we're joined with a lot of other states now that are also adding this as a covered benefit in their Medicaid pilot. And so we'll get to demonstrate that and promote it as a really essential service that a Medicaid office can offer.
So for example, if a client is not covered by Medicaid or insurance, can you still offer them services?
Great question. Yes, we will definitely. We always provide services regardless of ability to pay. So insurance is not required. And that's why our grant funding is so important to us. It allows us to provide services regardless of insurance status.
Okay. And then aside from just a place for people to recover comfortably, warmly, what other services are provided at this site? How is it different from some of the other respite options available?
I'll start and then I'll let Kate get into the details. But we, like I said, are building on the services that are already available. So it's not to replace the medical motel vouchers, for example, that we utilize, or the set-aside beds at Albuquerque Opportunity Center or Barrett Foundation that have recuperative beds for people to rest and recover in. What's different about this is that it's a freestanding facility, so 50 beds specific to medical respite with on-site integrated health care and social services provided 5 days a week. And so continuous connection to your primary care home, and then a really strong focus on exit to housing. So having dedicated housing resources, housing vouchers to medical respite. The City of Albuquerque also has a contract with us to provide medical housing vouchers. So on exit, we should be able to exit people into a housing voucher because of some of those dedicated resources, and that sets it apart and gets back to the decrease on the system. So we know if we exit people into housing, they're not going to be cycling back through the shelter and the street and the hospital, effectively ending their homelessness and having great systems impact to our healthcare providers, our law enforcement, first responders, and the system as a whole. And I'll let Kate talk about the specific services.
Yeah, so I think we've touched on this a little bit already, but we'll have a medical team coming by throughout the week to round on patients and really make sure that we're providing them integrated care so that they can reach different goals in their care plan. So that includes dental. We have a hygienist and 2 dentists in our clinic, and so they'll be rounding as well to help provide some of those services. We'll have medical providers. We do a lot of primary care, and for us that's pretty broad because we take care of a lot of folks and we really try and keep folks out of the hospital. And so We'll manage their chronic conditions like diabetes and high blood pressure. If they need help with, addiction medicine or opioid use disorder, we can start folks on medications for that as part of this program. Kind of you name it, as long as it is an outpatient service, we offer it. We also have psychiatry, as I mentioned before, and so really working with folks to identify if there's a medication or other treatment that could help behavioral health needs or psychiatric needs. And then we have a behavioral health team as well. So we have 5 behavioral health therapists who will be also rounding at Medical Respite. We have space in Medical Respite to offer groups. So we have very successful programs at our current campus where we offer behavioral health groups, and sometimes that's in collaboration with a medical provider. So we'll be able to offer those things at Respite as well. And then we have pharmacy services. So we will be able to fill prescriptions for folks at our in-house pharmacy and deliver them over to Respite to really help and make sure that everything's sort of there and ready to support the patients. There's a space in Respite also for PT and OT. So if folks are recovering from injuries and things like that, where they'll need recuperative services in that sense. We also will have that available at Respite too.
Is there anything that isn't there? That's it really does sound like it covers almost the full gamut.
Yeah, and anything that's not provided there, as the lead medical respite provider, it's our responsibility to connect people to those specialty services. So making sure that if they're doing cancer treatment follow-ups or seeing another specialty care provider in the community, that we're helping coordinate their transportation, making sure they get to those appointments, or bringing in those providers to see them in respite.
I had a question related to the staffing for all of this. The information sheet that we saw for Albuquerque Healthcare for the Homelessness shows, and obviously you've described, there's going to be these medical services like managers, medical assistants, social workers, on-site clinical team, kind of what we just went through. Is it difficult to find staffing, or has it been difficult to find staffing for these positions? And with a healthcare provider shortage, in mind that is happening here in New Mexico still, how sustainable is this into the future?
Yeah, I think the short answer is yes, staffing is a challenge for us the same way it is for, everywhere across the state and really across the country, it seems. I think we've been able to have some very creative staffing plans that we do in general for our clinical services, but that will also extend to Medical Respite. So Respite will have one full-time nurse who will handle the intakes and sort of the day-to-day operations. And then our medical team will be coming from our clinical site now. So it'll be existing staff that'll be visiting and rounding at Respite throughout the week. We also have excellent partnerships with the UNM College of Nursing and College of Pharmacies. And so we've really been able to engage those partners as well to help provide us staff for some of our clinical services. So yes, and yeah, I mean, I think we're always looking for ways to make sure that we have the right staff, who are really dedicated to our mission, but also to be creative about how we do that.
Yeah, and it certainly sounds like, that it is recognized that there are issues with staffing, and that's part of coming up with the plan, is to try to figure out how to work around them and into the future. So,
are you all fully staffed now?
We are, for Respite, we are. We have identified our nurse manager who will be over. She's someone that's coming from our current site, and she's been working with us for about a year, and she's going to be moving over to Respite to help run that program. So we're really excited about that. Okay. She has a lot of experience in the community, and I think she's going to be a really great asset to Medical Respite.
This space is 8 years in the making. Looking at the timeline, there were several phases, including the city buying the Gateway Center in 2021, which we covered a lot in our newscast and on this show. But what was the biggest contingency or buy-in that you all had to get in order to finally open, and when might we see the Respite open?
Yeah, So the open house that we just celebrated, and we were so excited to show off the space, the first step was having that certificate of occupancy. So knowing that the space is now ready. And once we had that in place and then our MOU with the city, we were able to kind of go start our compliance checklist for our federal funding, and then same with our partners as well. And so that process is now kicked off now that the certificate of occupancy has been finalized and we've been able to show off the great space. And so all the partners are now going through their compliance checklist to be able to start services. So we're hopeful that those services will start as soon as possible.
Okay.
There is a capacity of 50 beds right now, and I think we talked about a little bit earlier. The idea is to see this hopefully expand. It doesn't sound like the 50 beds is enough right now, but maybe just ask that. Is it enough for what we have right now, or do you expect it to be kind of at capacity as soon as it's ready to go?
I expect it to be at capacity. We're going to have a ramp up period to make sure that we staff up appropriately and that the services are high quality as we take in new patients and referrals. But I think it makes sense to focus on the 50 beds so that we can really have high fidelity to the National Institute for Medical Respite Care standards. There are some national standards that we've designed our independent evaluation to be able to measure, and we want to demonstrate high fidelity to that model and show that we're having an impact and that we're reaching the goals that we set out to achieve in our Medical Respite Collaborative. So to start with those 50 beds for the first 5 years of the pilot with the Medicaid waiver and the first 5 years of the pilot as a program will allow us to be able to demonstrate the impact and prove the outcomes so that we could grow it in the future and identify what needs we might want to grow into. So right now it is post-hospitalization, pre-hospitalization, but there are other ways that you could look at respite. You could talk about hospice care, for example, and that's something that's not in this phase but might be in future phases, and getting the information, the data that we're going to be collecting from our Medical Respite Collaborative will help us design how we expand and grow in the future.
I have one broader question about just the impact that this has here on homelessness in Albuquerque. Obviously, an important component of it is healthcare, but we know that healthcare is not the only component of addressing homelessness here in Albuquerque. And the Gateway Center has been this long project of the Keller administration to try to rope in everybody that you would need to be this one-stop shop for addressing homelessness here. It's been years in the making, as Gabby mentioned. The facility finally does seem to be adding a lot of the critical components, including this piece. Just as providers here in this community, do you feel like Albuquerque is turning the corner in having everything it needs to address homelessness? I say that knowing that there's obviously a lot of work to be done. I don't think anyone thinks that this is the end, but do you see the city in general as turning the corner in addressing homelessness with additions like this?
Well, one of the things that Healthcare for the Homeless works on, we have a pretty robust policy and advocacy agenda. And so healthcare, yes, is a big component of the work that we do, but housing is also a big driver of homelessness, and it is the solution. So investing in affordable housing and making sure everyone has a safe place to live that they can afford is the ultimate solution to homelessness. And why we're so excited about respite is that it's a great opportunity to engage with people and exit them into housing. So we didn't really touch too much on our case management, our public benefits work, housing navigation, but it's a big component of medical respite. And those are all the services that really need to be funded at a scale that's needed to make sure people have access to income supports, disability benefits, and then have the housing navigation to navigate a really challenging housing market right now to get them into housing as quickly as possible. And so when we think about what's still needed, we still need that big investment on housing at the local level, at the state level, and at the federal level. It's not just on the city, it's on all levels of government and on our partners to all be working together towards that big solution of making sure everyone has a safe place to live, because that's how we know our communities will be safe and healthy.
Mm-hmm. Anything you want to add to that, Kate?
I just to add that I definitely appreciate the focus that the city is placing on access to housing and on the Gateway Center. I think it is going to be a huge push in the right direction. And I think the other thing I'll mention is just, we feel like really partnering is with multiple different organizations and entities is really the way forward. we know that healthcare for the homeless can't be and isn't the one-stop shop, all things to all people. And so we really rely on these really deep and strong partnerships that we have within the community. And I think that's really going to help us charge forward with this as well.
We talked about some of the criteria, but I was curious too, is the Medical Respite Center, will it accept men, women, families?
Yeah, so single folks, yes. We don't have an option for families at this point. That's definitely something that we've contemplated, but for a lot of reasons, we need to move forward with just having the patient. And so all genders, absolutely. Most of the rooms are single and double occupancy, so it allows us to really take all genders and not have to, pick and choose that way, which is really nice. Patients can, we want to make it as home-like as possible. We do have a lot of things in place, such as folks can bring any pets that they normally would have with them at home if they're on the streets. That's a big thing. So we do have a limited policy around pets, but unfortunately we don't have a mechanism to have folks bring partners and families in with them. We don't have the space for that and some of the other pieces that would require. So something to think about for the future, I think, but not for right now.
Got it.
We'll be right back with more on New Mexico News Insiders.
Hi, I'm Monica Wicki, host of New Mexico Living. This episode of New Mexico News Insiders is sponsored by New Mexico PBS. If you enjoy New Mexico News Insiders, check out New Mexico in Focus, a great source for insights about what's happening in our state. Catch their podcast and videos at nmpbs.org or stream it anytime, anywhere on the free PBS app. Now, let's continue to New Mexico News Insiders.
Anything else we're missing that you all want people to better understand about this project that we haven't asked you about?
I don't think so. Y'all have been very thorough in your questions.
Oh, good.
No problem. That's all
I
good.
I think I can just wrap up by saying we appreciate the support that we've received from the community. I think you've seen a kind of groundswell of support for medical respite. As you noted earlier, everyone has seen someone walking down the street in a hospital gown that is at high risk of early death on the street. And this is such a straightforward solution to addressing some of those gaps in our system and that need. And so we are so thankful to have that community support, and we look forward to working with our community, our donors, our partners to ensure that this lasts into the future. We have great sustainability models and financing mechanisms, and we still need the support of our community to continue to do that for the need that we have, the growing need in the community of people experiencing homelessness that need medical respite. And so if folks are interested in supporting Albuquerque Healthcare for the Homeless, they can check us out at abqhch.org and look at how to get involved, how to support us financially, and make sure that we are able to continue our mission and our vision to live in a world that's just and without homelessness.
All right.
Rachel and Kate, thank you so much. We really appreciate you guys.
Thank you so much.
for
Really
having us.
appreciate the time.
Yeah.
Thank you.
Thank you. Again, a big thanks to Albuquerque Healthcare for the Homeless, Rachel Biggs and Kate Morton joining us here to talk about this groundbreaking service, I would say, that is going to be expanding here in Albuquerque soon and opening soon. As if we're recording this, they do not have an opening date, but hoping that this is something that will happen in the early part of the year here.
Yeah, she said she will definitely keep us posted. So if it happens after this or right before we publish, we can add it in the web script. Always feel free to reach out if you all have a story idea. I'm Gabrielle.Burkhart@krqe.com via email and gburknm on social media.
I'm Chris.McKee at krqe.com, also at Chris McKee TV. And don't forget, you can catch the full conversation at krqe.com/podcasts, also youtube.com/krqe. Thanks again for listening and watching.